The first definitive sign of pregnancy identified by a sonographic study is the formation of the gestational sac. The bright echogenic ring seen in the vicinity of the endometrial cavity is made up by the growing chorionic villi. The gestational sac could not be seen until roughly 6 menstrual weeks using transabdominal equipment. However, with the new high-resolution real-time equipment, especially those with transvaginal probes, the gestational sac can typically be seen by 5 menstrual weeks. In a normally developing pregnancy, the menstrual age can be estimated at this early stage of gestation by measuring the average internal diameter of the gestational sac, which is determined by averaging the anteroposterior, transverse, and longitudinal diameters. This measurement is known as the mean sac diameter, MSD. The measurement of the mean sac diameter is obtained from the interface of the chorionic villi and the chorionic fluid. Therefore, it represents an estimate of the mean internal diameter of the chorionic sac. The wall of the sac is not included. When it comes to the size of the gestational sac at first, there is less disagreement. This is currently estimated to be between 2 and 3 mm MSD. It is fair to predict that at 5 weeks, a gestational sac will measure 5 mm. Two features separate the gestational sac from the pseudogestational sac in an ectopic gestation, while the early embryo is not yet visible. Firstly, the double sac sign can be observed by noticing the deep layer of the decidua parietalis and the early villi, which are separated by the more superficial and less echogenic layers of the decidua parietalis. Second, the intradecidual sign, in which the developing sac deviates the endometrial cavity reflection because it is embedded in the decidua, is also significant. Seeing an embryo or embryonic structure is a more trustworthy indicator than the other stated characteristics. The yolk sac is the earliest embryonic structure that can be seen using sonography. During the 5th menstrual week, this can be seen using high-resolution vaginal probes. MSDs typically range from 6 to 12 mm when a yolk sac is visible in the absence of a current embryo. The yolk sac is evident before the embryo is apparent in this transvaginal high-resolution real-time image. As the first trimester of pregnancy progresses, the MSD's predictive power for menstrual age gradually decreases. Crown-Rump Length, CRL, is the preferred measurement to determine menstrual age after the embryo is visible.